Great, thanks Shireen. And thanks to everyone who managed to find the room. So it took me about 45 minutes. So well done everybody for finding your way. And thanks to the guys doing the BSL interpretation today. So they've told me they're going to try and sign an Irish accent for me. So I'm not sure how they're going to do that. So lovely to see you all. There's a few more people coming in, so come on in and have a seat. And there's loads of people leaving. Anyway, it's lovely to be here. Thanks very much. Well done for Shireen and all the team who've done far more. I'm basically just turning up and giving my talk. So thanks for having me. I really appreciate it. So I'm kind of I've put a pretty lofty question there for a gastroenterologist. Can a plant-based diet change your world? So I'm a medical doctor. I work at Torbay Hospital. I've got a small private clinic as well. I went to medical school in Cork, in University College Cork, and practiced medicine there. I graduated medical school in 2001. So I'm very much a conventional and mainstream medical doctor. So a part of this talk is about where are we with that now in 2019. Over a century ago, Thomas Edison predicted that the doctor of the future would actually give no medicine, but would instruct his patients in the care of the human frame, in diet, and in the cause and prevention of disease. I think he'd already recognized in the early 20th century that lifestyle medicine and unlocking lifestyle medicine might be the key to keeping people healthy and helping them to stay healthy. Unfortunately, over a century later, as physicians, we have completely missed the mark on that. To the point that in this opinion piece in the Journal of the American Medical Association, Journal of Medical Ethics, it's a mouthful, last year, David Katz made this statement in a kind of a rallying call to doctors around the world to sort of wake up to the need for more diet and lifestyle advice as part of conventional medicine. And it's sad but true, but the food that we eat now is now the main determinant of poor health in the Western world. So food, as he says, has undergone a truly dramatic transformation from essential sustenance into the single leading contributor to chronic disease and premature death. So can a plant-based diet change your world? So I'm going to talk mostly about my own areas of expertise, which are about gut health, health and longevity. Asking, can a plant-based diet help you to avoid long-term disease and long-term medication? And then I'm going to address some of the other questions that may not be my areas of expertise, but they always come up, and I hear people talking and asking about them a lot. Could you somehow be leaner or maybe even more athletic on a plant-based diet? Can you tread more softly on our planet? And can a plant-based diet help you to exercise compassion? But before we do all that, let's come back into my clinic. So the reason that I advocate and recommend a whole food plant-based diet isn't because I went to medical school and I was a vegan at medical school. The opposite may be true, actually. But really, it was my patients who brought me to a whole food plant-based diet. So one of the things that I spend a lot of my time treating, even since I think as a very newly qualified doctor back in 2002. So for the last 17 years, on a day-to-day basis, I've been involved in treating people with a condition called inflammatory bowel disease. Now, these are a group of conditions, these inflammatory bowel diseases, where sections of your bowel become inflamed and damaged and dysfunctional. We have medications that can help to reduce the inflammation, but very seldom get people into complete remission. For example, with Crohn's disease, which is about half the cases of inflammatory bowel disease, half of the patients who are diagnosed with inflammatory bowel disease are going to end up having surgery to remove part of their bowel, basically to remove a diseased part of their bowel because it's not functioning anymore. Almost all of our patients with inflammatory bowel disease end up on long-term medication, and being diagnosed with inflammatory bowel disease is no fun. Most people with inflammatory bowel disease would describe their health as being below good. And the rates of work absenteeism and school absenteeism are very high. And in fact, the inflammatory bowel diseases are diagnosed at a median age of about 30. So these are usually young people in the prime of their lives. They're working, they've got mortgages, they've got young kids, and now they're being told that they've got to come to the doctor's office every 3 months. And there's a good chance they're going to end up on some medication that means they're going to have to come up to a day ward every 8 or 12 weeks and sit in a room that looks a bit like a chemotherapy day unit, to be honest, and go on a drip and have medication to keep their inflammation under control. Now, when I was at medical school, we were taught that inflammatory bowel disease was kind of the paradigm of an autoimmune condition. You've gotten unlucky in the genetic lottery. There's something wrong with your immune system, so it's attacking your guts. So that's it, you're stuck with it, and we've got some medication that can help. But in fact, the more I've looked at it, the more I've realized, and mainstream gastroenterology is moving this way, that there's a lot you can do with diet and lifestyle. So your future's not set in stone when it was coming to inflammatory bowel disease. And whenever I would see or have or meet a patient who's been just diagnosed with one of these conditions, they'd already figured out that there was something to do with food here. So I've heard people asking the same question since my first day on the GI unit back in 2002. Okay, so I've been diagnosed with this, you've explained all that stuff to me. Is there anything I can do with food? And they don't mean, is there any food I should eat today to feel better or worse? What they mean is there any food I should be avoiding that can help me prevent that progression you've just described with more and more medication and increasing likelihoods of having surgery? In medicine, we're all about trying to give our patients evidence-based answers. So we'll only give our patients advice or a medication if we can look at medical studies that show us that they work. So that's a big stack of medical journals there to illustrate the fact that I've read loads of medical journals. Because over the years, particularly since becoming a consultant in 2012 and more recently the lead for treatment of inflammatory bowel disease at my hospital, I've been trawling through the mainstream medical literature so I could give my patients evidence-based answers. And I guess what I learned was there's a lot of very strong evidence out there, lots of stuff about inflammatory bowel disease that I never learned at medical school. So I learned that IBD is not just a genetic disease. There are a lot of variants, various factors in the etiology of inflammatory bowel disease. And there's a huge amount of evidence that diet is extremely important, both in the cause of and the progress of inflammatory bowel disease. Inflammatory bowel disease didn't really exist as an entity in the early 20th century, but now it affects 1 in 300 people in Europe. Perhaps 1 in 200 people in the UK now has inflammatory bowel disease. You probably all know someone who has ulcerative colitis or Crohn's disease. When we look at the epidemiological data, there's very, very clear story that as countries industrialize their environment and industrialize their food chain, these diseases start to come up and start to get diagnosed. We saw it in Europe and the United States and Australia in the post-war years, and then more recently as countries like Japan and Egypt, etc., have westernized their lifestyles and westernized their diets, they're starting to see these diagnoses appearing. In fact, the Lancet Medical Journal a couple of years ago highlighted this issue in a huge editorial piece and just warned us that inflammatory bowel disease is actually a slow epidemic. In a few years, we're not going to have the resources to treat all these patients. And when we zoom in on the dietary risk factors, there's really compelling evidence that shows that dietary fiber, just the fiber that you get from eating plants and whole grains and vegetables, actually strongly protects you from developing inflammatory bowel disease. And there's strong evidence that eating the animal protein, so the more animal protein you eat in your diet, the more likely you are to develop inflammatory bowel disease. There's plenty of studies showing that dairy fat can induce inflammatory bowel disease. And there's some really, really interesting research that we could have spent the whole day on today on the effects of animal-based diet on the gut microbiome. So we've seen studies where you take people and you put them on a very animal product-heavy diet, and their gut microbiome changes into a pro-inflammatory gut microbiome, which is actually capable of inducing inflammatory bowel disease. And there have been so many studies showing that food additives that we get in processed foods, like emulsifiers, polysorbate, maltodextrin, carrageenan, the evidence showing that these food additives are so pro-inflammatory in the intestine, particularly in patients with inflammatory bowel disease, that a few years ago a team of researchers wrote to the Journal of Crohn's and Colitis and said, we've cracked it. Emulsifiers are causing Crohn's disease. They called it the emulsifier hypothesis of Crohn's disease. But in a way they were right, but it's a much bigger story than that. So over the years, because I would go and look at all these various studies from disparate sources, these epidemiological studies, lab studies, dietary intervention studies, I slowly came up with this green list and this red list. So when my patients say to me, is there anything I should eat? Is there anything I should avoid? I came to the point where I would say to them, well, look, I'd prefer if you totally cut out processed foods and really avoided animal protein and animal fat and dairy. And I want you to avoid, in particular, food emulsifiers that are found in a lot of processed foods. And I want you to avoid the food additives that are found in a lot of processed foods. And I want you to build your diet around whole, unprocessed foods: fruits, vegetables, legumes, walnuts, flax seeds, beans and seeds, and whole grains. So before I even knew what a whole food, plant-based diet was, I was already recommending to my patients that a whole food, plant-based diet is really what the evidence tells us. If you want evidence-based answers, there's your evidence-based answer. Eat a whole food, plant-based diet. It's impossible to read all that research about Crohn's and colitis without reading a lot more research about the effect of diet on the diseases and disorders that I see in my clinic every day, that we see on our hospital wards every day, or in our GP's offices, et cetera, et cetera. So I won't go through all of these, but it turns out that a whole food plant-based diet seems to tick all the right boxes for long-term gut health, whichever of these conditions you're looking for. So diverticular disease is a condition whereby you get these little pouches in the side of your bowel, predominantly your large bowel. They can get clogged up, they get infected. Your gut gets inflamed around the pouches. You can get stricturing. You can end up having a perforation or an abscess. You can end up in hospital. You can even have part of your bowel removed due to diverticular disease. Now, gladly, most people with diverticular disease don't end up seriously unwell, but they do have bothersome symptoms, and it reduces their quality of life. We've known since the 1970s, when Dennis Burkitt was writing about his experience as a surgeon working in London and working in rural Africa, that among populations who eat a whole food plant-based diet, particularly a high fiber diet, nobody gets diverticular disease. Yet diverticular disease affects about 80% of 80-year-olds here in the UK, about 30% of 30-year-olds. And in fact, in the US, you can almost call it ubiquitous. If you live long enough in the United States, you're probably going to get diverticular disease. And if you have diverticular disease, and if you look at the studies showing, well, what are the characteristics of your diet that predict running into trouble with your diverticular disease? It's high meat and low fiber are going to run you into trouble. I'm just going to talk a little bit about colon cancer. Unfortunately, in my job, I sit down with people all the time and I tell them that I've just diagnosed them with colon cancer. So I might do that once, twice, or 3 times per week. Now, that's always a very difficult conversation, and I'm very aware that that person's going to remember that conversation forever, and it's going to change their life forever. Even if they do really, really well, it's going to change their life forever. So what about a whole food plant-based diet and colon cancer? Well, we know, even Cancer Research UK, who would be relatively conservative in their estimates, would estimate that 55% of cases of colon cancer in the UK are due to 3 factors, one of 3 factors: low fiber diet, red and processed meat consumption, and being overweight or obese. Just those 3 things. So 55% of the 42,000 cases of colon cancer that occur in the UK every year are entirely preventable by diet and lifestyle. And I haven't even mentioned alcohol and smoking. Just food we eat and physical exercise and maintaining a healthy body weight could dramatically reduce the numbers of patients who have that difficult conversation with somebody like me every year. Just at the end there, NASH cirrhosis. So NASH is non-alcoholic steatohepatitis, or fatty liver disease, or foie gras liver, if you want. So this is a condition whereby you have fat deposited on your liver. Your liver doesn't like having fat deposited on it, which causes the liver to be inflamed. And about 10% of people with NASH, that condition, will end up developing cirrhosis of the liver in about 8 or 9 years. That's without touching a drop of alcohol. It's completely separate to alcohol or other chronic diseases of the liver. Having cirrhosis of the liver reduces your life expectancy. So it's surprising that this condition that wasn't even described in the medical literature 50 or 60 years ago now affects 20 to 30% of people in the UK. So we have an absolute epidemic of NASH cirrhosis. And when we look at the dietary risk factors for developing NASH and putting yourself at risk of NASH cirrhosis. It's the more animal products you consume and the more processed foods and free sugars that you consume. What's the antidote to that? Whole food, plant-based. We're seeing NASH cirrhosis all the time in our hospital wards now. And essentially what we're seeing, and I can think of maybe 2 or 3 episodes of this already this year, is we'll sometimes get, for example, you saw an elderly person who's been admitted to hospital with pneumonia or a urinary tract infection or some sort of infection that can be serious enough when you're old, but usually people get better from, and they've been in hospital for 2 or 3 days, and then they go yellow because they become jaundiced, and then they become encephalopathic and drowsy, and then they go into a coma. And then we have to sit down with their family and say, well, actually, your mum's dying now. She's got liver failure. And they say, well, why is that? We say, well, the scans show that she has cirrhosis of the liver. They say, well, she never drank a drop in her life. We say, we know. This is NASH cirrhosis. We're seeing it more and more. So as a gastroenterologist, I recommend a whole food plant-based diet rather than a Western diet. For the same reason that my friends who are orthopedic surgeons tell their patients not to go skiing, because they've seen the harm that it can do. And I see the harm that a standard Western diet does every day of the week. So that's how I kind of came to reading all this research and, talking to my patients with GI problems about eating more whole food plant-based. But I guess it comes to a bigger question, doesn't it? So if diet is the problem, so as we said at the start, diet is the single biggest cause of death and disability, what's the solution? There's so many solutions offered out there in the public domain and within medical journals. So I might be telling you stuff you already know, but who hasn't heard of the blue zones? Okay, so I'm speaking to about 7 people here. Okay, that's great. Well, for all 7 of you, so about 16 years ago, Dan Buettner and a team of researchers, he was a journalist, he had a team of epidemiologists and medical specialists, and they went around the world looking for the people with the longest lived and healthiest lives in the world. And they found these 5 geographically diverse areas in Loma Linda, California, Nicoya Peninsula, Costa Rica, Sardinia, Ikaria, Okinawa, Japan. And these were the areas in the world where not only, when you hear people talk about the blue zones, let's say, these are the places where you're most likely to live to 100. And that's a great headline. But if you're going to be healthy at 100, you have to be healthy when you're 16, and when you're 26, and when you're 36. So this is generally where people are healthy throughout their lives and at all stages of their lives. And as you guys know, because you've all heard of the blue zones, except those 7 guys over in the corner there, when they went to the blue zones, they found these incredibly healthy people. And why were they so healthy? Because in Okinawa, Japan, they found the people with the longest disability-free life expectancy in the world, living for 7 years longer than the average American. But they were living with far less disease. So much less breast cancer, much less colon cancer, much less cardiovascular disease, and all of that added up to a perfect recipe to be healthy at the age of 100, and they had 5 times as many centenarians as the average American. And you'll have seen this slide before. What were they eating? If food is the #1 determinant of our health and longevity, what were the Okinawans eating? That's a very detailed slide. That was from a paper that was published in the Annals of the Academy of Science way back in 2007. But essentially, it's whole food plant-based. These people, the food that they were eating was 96% of plant origin. They were eating very, very, very little animal products. And in fact, they were only eating them on special occasions, really. I think I remember there was like a particular pork dish that they had at religious festivals or something, which accounted for their animal product intake. So Loma Linda, California, amongst the Seventh-day Adventists, they found another blue zone, another community of people who were super healthy, right in the United States, which we hold up as the paradigm of poor dietary habits. And they found that among this group, males were living 11 years longer than the US average, females living to 89, 9 years longer than the US average. And the Seventh-day Adventists are really interesting because they're actually a fairly similar group, whether they, in terms of their diet and lifestyle, because they put a great emphasis on physical activity and going outdoors. They don't smoke, they don't drink caffeine. They've got a great sense of community, a great sense of purpose. But of course, I want to know, what are they eating? And because of their religious beliefs, the Seventh-day Adventists hardly eat any animal products. And in fact, among the Seventh-day Adventists who do eat animal products, it only accounts for about 4 or 5% of their caloric intake. So they don't eat a whole lot of meat. And just going back to that previous slide, with that diet and lifestyle, they have far less breast cancer, digestive cancer, heart disease, stroke, and type 2 diabetes than the average American. Just on the right-hand side there, you may have seen those pictures before. That's a lady who's, I think she's like 102, and she's just driving to the old folks' home to hand out teas to the elderly folk. And that's the legendary Dr. Ellsworth Wareham, the 104-year-old gent who passed away last year. So he was a cardiothoracic surgeon who ate a plant-based diet all his life. And I think he practiced and operated up to his mid-90s. So we talked about colon cancer earlier. It's so common now, 1 million cases worldwide every year, and 40% of those are in the US and Europe alone, where 13% of the world's population live. So people may think it's inevitable, that it's just genetics, there's something about us that we're determined to get colon cancer. And I mentioned earlier that 55% of cases in the UK, that's over 21,000 cases of colon cancer, are thought to be due to either meat, low-fiber diet, or obesity. But if you switch to a plant-based diet, you can reduce your risk in weeks. There's a lovely study done about 3 years ago where they took a group of African Americans and a group of Southern Africans living in rural Africa eating a traditional plant-based diet. Now, African Americans have a very, very high rate of colon cancer. I think it's about 1 in 15, to the extent actually that African Americans are targeted for colon cancer screening in the US because they're high risk. So they have a risk of about 1 in 15. The rural Africans on their traditional African diet have a rate closer to 1 in 10,000. There's no colon cancer there. And are these groups totally genetically different, or is it their diet? So in this study, they took the African Americans and the Africans. Everybody had a colonoscopy, so they're all agreed to that. Half of the African Americans already had precancerous polyps. None of the Africans had polyps. And then they did a lot of really fancy science. So they looked at their gut microbiome, they looked at the protective levels of short-chain fatty acids like butyrate. They looked at something called the mucosal proliferation rate, which is a risk of your long-term risk of developing cancer. And as you'd expect, the African Americans were red in everything. They had high risk on everything. And the Africans were green on everything. They had a low risk when it came to all of those markers. Then they simply swapped their diets. So the African Americans started having okra and potato salad, and the Africans started having corned beef hash and bacon and eggs for breakfast. They just did it for 2 weeks, and then they repeated the colonoscopy and did all of the tests again. And just in those 2 weeks, even the researchers were surprised by the dramatic change. In fact, not only did the risk factors flip, so suddenly the African Americans had a very low risk of developing colon cancer. In fact, their risk was lower than the Africans. So you can really change your destiny in terms of these diseases that we would regard as inevitable. And of course, you can't talk about the medical benefits of a whole food plant-based diet without talking about heart disease, the top cause of death in the UK, 160,000 deaths per annum, 23,000 premature deaths per annum. So 23,000 people in the UK die before their time every year due to heart disease. And we view it as inevitable in the UK because it's so common. So in your 40s or 50s, you get high cholesterol, you get put on a pill. In your 50s or 60s, you have angina, then you get a stent, and then you have a heart attack, and then you die because that's what happens. We view it as inevitable, but of course, it's not inevitable. So here's a nice study that was done a few years ago, I think in Sweden, and they took 20,000 healthy middle-aged men and followed them for 12 years. So this is just the age group where you'd be expecting to see heart attacks and strokes and cardiovascular disease. And they looked at 5 heart-healthy habits: not smoking, keeping your alcohol intake to a minimum, exercising quite a bit, and eating the most fruits, vegetables, whole grains and legumes. And surprisingly, they found that the small number of men who did all of those, who ticked all 5 boxes, who were super healthy, they actually reduced their risk of coronary vascular disease by 86 to 96%. So they basically made themselves heart disease proof. I think this is a really nice paper because a lot of the time, one of the arguments against whole food plant-based is, well, everything in moderation. I think this study is a really nice demonstration that if you have a moderately healthy lifestyle, you're going to have a moderately healthy life. Have you ever gone to see a movie that your friend said was moderately good? Why are we all aspiring to moderately good? And of course, we have Dr. Dean Ornish's landmark work from over a decade ago now, 1998. where he was showing you could take patients with heart disease, put them on a low-fat, whole food, plant-based diet, as well as other positive dietary or lifestyle interventions, and you could halt and even reverse their coronary artery disease. And you've probably seen a slide like this before. So that's a coronary artery bringing blood to the heart. Just about here, it gets narrow. The white bit is the artery. It's all gummed up with atherosclerosis. I think this was 32 months on Ornish's program, whole food, plant-based, low fat, and the blockage is gone. Blood supply is back to the heart. And that's a patient who used to have crippling angina, and was at a high risk of having a heart attack, and is now no longer in that situation. Type 2 diabetes. So type 2 diabetes is a syndrome of insulin resistance. You need insulin in your body to push the sugar into your cells because your sugar need the sugar because it's their primary energy source. If you have type 2 diabetes, the sugar isn't getting into your cells. It's floating around in your system and causing harm. If you have type 2 diabetes, you require medications and insulin, and overall, your long-term health is put in jeopardy by this diagnosis. Now, 60 years ago, only 1% of the US population had type 2 diabetes, but now 1 in 10 US adults have type 2 diabetes, and 1 in 17 UK adults have type 2 diabetes. And it's projected that by 2025, we'll have 5 million people with type 2 diabetes right here in the UK, which is going to take up a significant chunk of the NHS budget, perhaps 10 or 15%. So what do we know about diet and type 2 diabetes? Now, the Rotterdam Study was published 2 years ago, I think. They took 7,000 healthy older adults, followed for 7 years. They looked at their dietary intakes. So what's putting them at risk of diabetes? Are they eating too much fruit? Are they eating too much sugar? Is it too many bananas? Or is it too much meat? And they just followed these people for 7 years. And those researchers came up with a pretty startling result. Well, not startling to me, though. And they, in the paper, they said that a more plant-based diet and a less animal-based diet may lower your risk of developing diabetes. And in fact, they estimated that if they could get the standard eater, or the standard person, the standard omnivore, to reduce their meat intake to 50 grams per day and double their increase of fruits and veg, they would reduce their risk of type 2 diabetes by 17%, which doesn't sound like a lot, but when you think about the numbers involved, that would literally be millions of people. But what if you go completely plant-based? I mentioned the Adventists earlier, so here's the Adventist Health Study 2. They followed Seventh-day Adventists for 2 years. I'd already said that the Adventists who eat meat don't eat very much meat, just a little bit of meat. But in fact, the Adventists who didn't eat meat are significantly less likely to develop type 2 diabetes. Over a 2-year follow-up, 1 in 47 meat eaters developed type 2 diabetes compared to 1 in 185 on a completely plant-based diet. And the good news is that this isn't fringe medicine. This isn't controversial stuff. This is mainstream medicine. We've just seen the consensus statement by the American Association of Clinical Endocrinology and the American College of Endocrinology, which are the two main professional bodies that guide US policy on managing type 2 diabetes, where 10% of the population have diabetes. So in their guideline, they talk about diet and lifestyle before medication. And you can just see up in the corner here, what do they recommend for diet? All patients should strive to attain and maintain an optimal weight through a primarily plant-based meal plan. They're not telling their patients to go paleo. They want them on a plant-based diet. And in fact, that professional guideline, which also talks about all the medications and the insulins and the new insulin sensitizers, tells us that doctors need to be supporting their patients in going plant-based and need to be giving them shopping lists and meal plans and tips for dining out. So I think plant-based is certainly entering the mainstream in some regard. Which is why I get a bit worried and a bit frustrated when I see some voices within the NHS and within public policy in the UK calling for a low-carb, high-meat, kind of paleo-style approach to treating diabetes by essentially if we take all of the sugar out of your diet, we can keep your glycemic levels, good, so therefore you're cured. Because not only does that kind of run against the long-term evidence, we've seen numerous studies in the last few years showing that the more meat you eat, the more likely you are to develop a chronic disease. So here's a nice study from a couple of years ago, 15,000 adults followed for 25 years, and the conclusions included low-carb dietary patterns favoring animal-derived protein and fat were associated with an increased risk of dying during those 25 years. And similarly, plant-derived protein and fat intake from sources such as vegetables, nuts, peanut butter and whole grains were associated with lower mortality. So you were less likely to die if you're eating more of those foods. They estimated that if you took a standard 50-year-old on a low-carb diet, they were knocking about 4 years off their life expectancy. And I've got some more studies here which basically show the same thing. Sometimes when I show those slides, people say, well, we're all going to die sometime, so it doesn't matter. But of course, I'm not talking about dying. I'm not talking about the disease you die of. What I'm really talking about is the disease that you live with. So if you die from cancer, you have lived with cancer. If you die with coronary vascular disease, you've lived with coronary vascular disease. You've been to the doctor's appointments, you've taken the medications, you've tried to find the right medication, you've had side effects from that medication. So it's more about quality of life rather than duration of life specifically. Now, don't get me wrong, I'm not a doctor who doesn't prescribe medications. I've got a prescription pad on my desk. But if we don't include the diet and lifestyle aspects, we are only treating part of the problem. Just a few slides on obesity. I'm certainly not here to fat shame anybody or give anybody a hard time for being overweight. It's all too easy to be overweight in our current food culture. And in fact, there's nothing exceptional about being overweight. A third of people in the UK, a third of adults in the UK are overweight, and a third are obese. But unfortunately, being overweight and carrying extra weight does increase your risk of various health problems, including, and not limited to, increasing your risk of developing various cancers. So what about a plant-based diet and being overweight? The Adventist Health Studies, as I said, are really, really useful in this regard because we've got a whole population that are pretty similar in terms of their diet and lifestyle, but some of them eat meat, some of them eat fish, some of them are completely plant-based. And what these two slides show you, on the left-hand side, we've got body mass index. That's basically a measure of your body weight. And this is the non-vegetarian group, semi-veg, pesco-veg, so that's vegetarian or vegan plus fish, lacto-ovo-veg, so veg with milk and eggs, and vegan. And we have the same thing here. So basically from red down to blue is less and less animal products in your diet. And when we look at the Adventists who are completely plant-based or vegan, they are the only group whose mean body weight is healthy, and they only have 2.9% incidence of type 2 diabetes. And we've also seen studies, particularly this one last year, published by Neil Bernard and his team at PCRM, where they took a whole cohort of overweight individuals who were really motivated to lose weight. They put them on a whole food, plant-based, low-oil diet for 16 weeks, and there was no calorie counting. And the average weight loss was about 1 stone in weight over 16 weeks. Compliance was 100%. And in fact, the more starchy carbohydrates, the more carbohydrates the participants consumed, the more likely they were to lose weight. But if you go plant-based, you're not going to fade away. You're not going to become invisible and turn into a little rake. And how do we know this? Well, we've seen lots of studies coming out in the last few years demonstrating the benefits in terms of athletic endeavor by being on a plant-based diet. So a plant-based diet, because it's made up of fruits and veg and beans and nuts and whole grains and legumes, every meal is packed with antioxidants and helpful phytonutrients to aid recovery and athletic performance. So I could show you some studies, or else I could just show you some really impressive athletes who eat a completely plant-based diet. So that's Kendrick Farris, the only US weightlifter to qualify for the Rio Olympics in 2016. And he did that on a completely plant-based diet. Of course, we're all familiar with the Venus Williams stories. She developed an autoimmune condition called Sjogren's syndrome, adopted a whole food plant-based diet, and credits that with her performance to her sport. That's Nate Diaz. Does anybody know who he's beating up there? It's famous Irishman, Conor McGregor, getting punched in the face by a vegan. That's Nate Diaz, mixed martial arts fighter and UFC 5 champion. And that's Tia Blanco, who is a world champion surfer and a powerful advocate for a whole food plant-based diet. So rather than showing you some studies there, just some pictures of people to prove that you can excel in athleticism on a whole food plant-based diet. So I want you to leave this talk with a feeling of optimism, because I feel pretty optimistic actually about the way things are going at the moment. Does anybody know what this is? Yeah, well done. So the Lancet Medical Journal is one of the oldest and most respected medical journals in the world. They've been publishing medical science for, I think, about 230 years. So every now and then they set up a commission where they send a bunch of experts off to answer a key question. And they sent 38 experts off a few years ago to find out, to review all the evidence. What is a healthy diet? What is the healthiest diet for humans to eat that will also keep our Earth the healthiest? Which I think is the same thing, actually, because essentially we're goldfish in a bowl. You can be the healthiest goldfish in the world, but if the water's too hot and there's a little bit of pollution in there, your goldfish isn't going to do very well. So those things are the same question for me. So they looked at all the evidence and they came back with this. This is their healthy plate. And as you can see, it's mostly fruits and vegetables. And I'll just bring you back to their statement. So planetary health plate should consist by approximately half a plate of vegetables and fruit. The other half, displayed by contribution to calories, should consist of whole grains, plant protein sources, unsaturated plant oils, and optionally modest amounts of animal sources of protein. So optionally and modest. So if you zoom in on that little bit of the plate here, and find that's the red bit there, and you'll see that's how much beef, poultry, eggs, and fish. I won't go through all of them, but how much beef did they say you should eat? Quote, the optimal amount of red meat to consume might be 0 grams per day, particularly when it is replaced with healthy plant-based sources of protein. But the evidence for harm at low levels of consumption is equivocal. Therefore, in our guideline, we would recommend keeping your daily consumption to 7 grams per day. They weren't saying eat this to be healthy. In fact, they're saying don't eat this to be healthy. But if you're going to eat it, eat 7 grams per day. What about eggs? They said that if you live in a situation where you don't have access to plant-based sources of protein, if you're in a deprived economy, perhaps, where you've only got access to yam or sweet potato or cassava, and that's the only food available, yes, you can improve the dietary content of your plate by adding some eggs, because they do have protein, and humans need protein. So if that's you, eat 1.5 eggs per week. If that's not you, then don't do it. I am feeling optimistic. Does anyone know what this is? There's a clue there on the left-hand side. Yeah, so this is the Canadian dietary guidelines. So these are the guidelines that will inform public policy in hospitals and schools, etc., on how they feed their clients. And that plate looks a lot like the stuff I've been asking my patients to eat for the last several years. So one interesting thing about the Canadian healthy eating plate is that when they were designing it, they refused to be lobbied by members of the food industry, and they didn't use any research papers that have been funded by industry. And with that, dairy's gone. There's no dairy section on their Eat Well plate. And you'll notice there isn't any meat section either. So they talk about eating fruits and vegetables and whole grains and drinking water and going for plant-based protein foods predominantly or entirely. So that makes me feel optimistic. This is something else that makes me feel optimistic. So that's the village that I live in the southwest of England, Shalden, population 1,700. We've got a tiny but lovely beach. We've got a lot of seagulls, and we've got a really old pub, the London Inn. And that pub's been there for an awfully long time. And you'll see people in there wearing muddy boots and wax jackets. There's always dogs in there. And I bumped into Tim, the landlord, a couple of weeks ago. He said, Alan, you've got to come into the pub this week. I was like, what? He said, we've got a vegan menu now. So that pub has got, it's not whole food plant-based, but I'll get him there. But they now have a vegan menu in that little pub. And I think the conversation is changing. And although lots of doctors like us are standing up and saying this stuff, it's really consumer demand that's going to drive this change. So I know that if you're ever in Shalden, do pop into the London Inn. So I feel optimistic. And if you want to share my sense of optimism, please join myself and Shireen and all the other professionals from Plant-Based Health Professionals UK in Warrington, near Manchester, April 13th. We have an event. Details are on the website. In London, we have Dr. Kim Williams, former president of the Merton College of Cardiology, doing a talk on the benefits of a plant-based diet. We'll also have a Q&A with the Happy Pear guys and the guys from Bosch and some of our own health professionals on the benefits of a plant-based diet. And I expect to see every single one of you in London in October for Europe's largest medical conference on the benefits of a healthy plant-based diet. The first day is a medical conference, the second day is open to the public. And I have this slide just in case there was any sneaky not vegans in the room who are thinking about making the change. But don't worry, I'm not going to shame you. Just quietly take a photograph of this slide and go through it later. Because if you are making the change, predominantly I want people to have fun with it and get a good cookbook and get some recipes and cook them and eat them and share them and enjoy them. Because again, doctors like us will stand up and show you all this science. But in fact, making this change is just a practical application of science. You've got to sit down, you've got to cook the food, you've got to eat it, enjoy it, and share it. Thanks very much.